Hey everyone, thanks for joining us today as we take a deep dive into a topic I know a lot of you are really interested in,
Yeah,
the global mental health crisis.
absolutely. It's something that touches all of us.
It really does. And, we're going to be looking at a lot of different aspects of it today, from, the prevalence of these disorders to some of the biggest threats that are, looming on the horizon.
Right.
And then, of course, what are some of the solutions that we can all be thinking about?
Exactly.
And I think one of the things that was really striking to me as I was preparing for this episode was that statistic that nearly 1 in 8 people globally
Yeah.
are dealing with a mental health disorder.
Yeah.
We're talking about 970 million people.
It's a staggering number, isn't it?
It really is. And I think, when you see a number that big, it's sometimes hard to really wrap your head around it.
Yeah, absolutely. And what makes it even more concerning is the lack of access to care for so many of these individuals, particularly those in low and middle income countries. I mean, over 70% of people with mental health conditions don't receive adequate treatment.
Wow.
And to put that into perspective, in some countries, there's less than one psychiatrist for every 100,000 people.
So you're saying there are places where an entire town
An entire
might
town.
only have one single person.
One psychiatrist, yes.
That's frightening.
It's a stark reality.
When you think about the scope of this,
It is.
and you mentioned the lack of access to care.
Yeah.
That's just one piece of this puzzle, right?
Mm-hmm.
We're also looking at, globally, depression is a leading cause of disability.
Absolutely.
Millions upon millions of people are impacted by that. We've got anxiety disorders affecting another, was it 264 million people?
That's right.
And then you throw something like a global pandemic into the mix.
Well,
I mean, we saw a 25% spike in stress-related disorders.
yeah, the pandemic really exacerbated a lot of these pre-existing issues.
Absolutely.
And it brought mental health to the forefront in a way that we hadn't really seen before.
It really did. And I think, it made a lot of people start to think about, okay, well, if this many people globally are struggling with this, statistically speaking, how many people in my life are dealing with these challenges too?
Right. It's closer to home than we often realize.
And I think it's really important to remember that this isn't just an adult issue either.
Oh, absolutely. No.
Right. I mean, the statistic that half of all mental health disorders begin by the age of 14
Yeah.
blew my mind.
Yeah.
Let me think about that. Before even reaching high school.
It's a critical time for intervention and, early support is absolutely crucial.
For sure. And that, I mean, the fact that suicide is the fourth leading cause of death for 15 to 29-year-olds.
It's a tragedy, and it really highlights the urgency of addressing mental health in young people.
What are some things that, parents, teachers, friends should be looking out for?
Well, some of the common signs can be changes in behavior withdrawal from social activities, difficulty concentrating, changes in sleep or appetite. And of course, any talk of self-harm or suicide should always be taken very seriously.
Absolutely.
Yeah.
And I think creating those environments where young people feel safe to talk about these things
That's key.
is so important.
Yeah, open communication is so vital, and it's important for young people to know that they're not alone and that there are people who care and want to help.
It's heartbreaking to think about all those young lives that are affected by this.
It is.
And it's not just individual struggles either. We're talking about, when global crises happen,
Right.
things like natural disasters, conflicts, pandemics,
Yeah.
all of those things have a huge impact.
So those events can be incredibly traumatic,
Absolutely.
leading to increased rates of anxiety, depression, PTSD.
And, you think about the displacement and forced migration that often follows
Yes.
these crises. It's just layer upon layer.
It really adds another dimension to this global mental health crisis.
For sure.
Yeah.
Then we have to talk about technology.
Yeah.
I mean, this double-edged sword.
Right. On one hand, it's a powerful tool for connection and access to information. But on the other hand, excessive use, particularly social media, can have detrimental effects on mental well-being.
Absolutely. And I
Yeah.
feel like, we see so much about the link between, excessive social media use and things like anxiety and depression and this, feeling of isolation.
It's like a paradox, isn't it?
It is.
We're more connected than ever, yet so many people are feeling increasingly isolated and lonely.
Do you think that has something to do with like the curated versions of ourselves that we're putting out there?
I think that plays a role for sure. The pressure to present a perfect image online can lead to comparisons and feelings of inadequacy.
For sure. I know there are plenty of times where I find myself, scrolling for hours and actually end up feeling worse.
Yeah, I think we've all been there. It's easy to get caught in that cycle of comparison and negativity.
Totally. And then when you add things like economic pressures into the mix, things like poverty and unemployment,
Oh, yeah.
and that creates a whole other set of challenges,
Absolutely. Financial strain can significantly exacerbate mental health problems.
especially in communities that are already struggling.
Exactly. It can create a vicious cycle where mental health issues make it harder to find and maintain employment, leading to further financial instability.
And then the stigma surrounding mental health makes it even harder for people to reach out for help.
It's a major barrier, and it prevents so many people from seeking the support they need.
For sure.
Yeah.
So let's talk about some of the root causes of this crisis because it's such a complex issue.
Yeah, it really is. There's no single cause, but rather a complex interplay of factors.
Right. So we've got biological factors like genetics and brain chemistry.
Yes, those are certainly part of the equation, but we also can't overlook the impact of social and environmental factors.
Hmm.
Things like domestic violence, poverty, discrimination, all of these can contribute to mental health issues.
It really speaks to the interconnectedness of all these different facets of our lives.
Exactly. Our mental well-being is influenced by a wide range of factors, and it's important to take a holistic approach to understanding and addressing these issues.
And then on top of that, we've got this rapidly changing world.
Yeah, the world is moving at an unprecedented pace, and the constant technological and cultural shifts can be overwhelming for many people.
That feeling of having to stay connected all the time.
Right, the information overload,
Yeah,
the always-on work culture, it's a lot to navigate, and it can take a toll on our mental health.
for sure. And unfortunately, the stigma surrounding mental health makes it even harder for people to reach out for help.
Absolutely. There's still a lot of fear and misunderstanding surrounding mental illness, and that prevents people from seeking the support they need.
So how do we combat that? How do we create a world where mental health is treated with the same compassion and understanding as physical health?
Well, I think it starts with open and honest conversations. We need to break down those barriers of silence and shame and encourage people to talk about their experiences.
It's about creating a culture of empathy and understanding.
Absolutely, where mental health is seen as just as important as physical health.
Right. And I think there are so many things that we can do on an individual level
Oh, for sure.
to contribute to that.
Mm-hmm.
Even just small acts of kindness and checking in on people.
Yes, simply listening to someone without judgment can make a world of difference.
For sure. And, I think the fact that there are solutions out there should give us hope.
Absolutely.
I mean, we can raise awareness, combat stigma,
Yeah.
promote mental health literacy.
Education is key.
Yeah.
And we need to start early teaching children and young people about mental health and well-being.
Absolutely. And then improving access to care, especially in those under-resourced areas, is crucial.
Yes, we need to invest in mental health services, training for healthcare professionals, and also explore innovative solutions like telehealth and mental health apps.
I think early intervention is so important too.
Yeah.
Imagine if we could equip schools and communities to recognize those early warning signs.
Absolutely. Early intervention can make a world of difference, and it's essential to provide support and resources to young people who are struggling.
And, what about things like government policies? What role can they play in all of this?
Well, governments play a crucial role in shaping mental health care systems.
Yeah.
They can integrate mental health into national healthcare policies,
Hmm.
make quality mental health care accessible and affordable,
Right.
and also invest in research to further our understanding of these complex conditions.
And I think that's something that's really important to remember, that this is not a static issue, right? This is something that is constantly evolving and changing.
Absolutely.
So to kind of bring this all together, we've got nearly 1 billion people worldwide facing these challenges, fueled by, this web of interconnected causes.
Yeah.
But there are solutions.
There are, and it's a global issue that demands a collective response.
So I want to leave you with this question. What role can you play in creating a more supportive and understanding environment for mental health in your own community?
Everyone can make a difference.
Yeah, whether it's starting a conversation, volunteering your time, donating to a mental health organization, even just educating yourself on the topic can make a difference.
Absolutely. Knowledge is power, and the more we understand about mental health, the better equipped we are to support ourselves and others.
This has been quite a journey, hasn't it? We've covered a lot of ground.
We have.
But the main takeaway, I think, for me is that you are not alone.
Absolutely.
There is hope,
There is.
and there's action to be taken.
And together, we can make a difference.
Thanks for joining us for this deep dive, and we'll see you next time.
See you then.
Bye.
Bye.